Welcome to the ManLab, where we combine science and health in the pursuit of making men great again.
This is how legends are born. This is how legends are born.
Hey guys, welcome back to the ManLab. My name is Blake and I'm here with Alex from T Clinics. Alex, he's the smart one, I'm the dumb one. I'm asking a bunch of questions today on testosterone, specifically TRT. I have to say it with the accent because if I say TRT, it sounds like tit. So look, I personally, guys, I don't take testosterone and I don't really plan on taking it for another 5 to 10 years just based on my preferences. But we are here today to find out what is TRT exactly, what does testosterone do for the body, what are the benefits, and what are the things to look out for and why you should or maybe shouldn't be taking TRT. T Clinics does offer testosterone as an option. So at the end of this episode, where our goal is to make sure that it is fully transparent. If it's not right for you, we don't encourage you to take it. And if you are interested in it, you can head to bit.ly/T Clinics USA. That is bit.ly/T Clinics USA. And if you don't want to remember that, you can just go to the description. There will be a direct link there for you. So Alex.
What's up, man?
Welcome.
Yeah.
Long time no see.
Nice intro.
If you guys you won't know this, but I stuffed it up a couple of times. I just edited it out. So testosterone is just in general, to start off with, why is it important to not only men, but also,
listen, I'm 44. I made a decision when I was in college to dabble in some things I shouldn't have dabbled with. Did some steroids, did some pro hormones, did probably more things than I shouldn't have done, and found myself, needing testosterone early in life. And so at actually 26 years old, I did a blood test to determine that my testosterone level was basically like in a woman's range, right? So low that it was almost not registerable. At that time, there weren't so many options to like basically fix it, and at that time I knew, which we'll get into, that the consequence of using testosterone wasn't something I was going to be worried about later in life, which was not having kids. So I decided at that point in my life that I wanted to go on testosterone, and it actually kind of led me into this business. But yeah, testosterone for men is the hormone that makes us basically men. It gives us that sex drive, it gives us that muscle tone, it gives us that masculinity, gives us a greater ability to metabolize fat, greater ability to have more cognitive function and energy and kind of cope with the day's shit that comes upon us. Gives us that fire in our ass. So, having low testosterone levels, pretty much sucks, and having a way to fix them if needed, I stress that, if needed, can do wonders for you, and so that's what testosterone replacement's about. Yeah.
And so for someone who's, before even considering TRT, what would someone have to sort of look at and consider before they
listen, testosterone replacement's not about looking more jacked for spring break, right? Or getting a better PR at the gym, because you're really, making a decision that's going to potentially be permanent in your life, right? So our balls as men basically are the factory that generate testosterone. We have this signaling factor that comes from our brain that kind of looks at the body and says, is there enough testosterone to function? And if that level's low, it sends a signal to the balls and says, hey, make more. And so if you start using testosterone as a replacement therapy, you're putting your balls out of business. You're basically saying, guys, you ain't got a job anymore because I'm taking this an alternative way. And whether it be from a shot or a pellet or a gel, you're putting your balls out of business. And over time, if you stop, and then they may not come back to work, right? So making a decision is because you're either finding that the things that we said before about like putting on muscle tone or having a sex drive or having erectile dysfunction or having energy deficiencies compared with where you think you should be, get your blood work checked and see kind of where you're at. Now, where you go, like especially like our clinic, should do more than just check just testosterone, because testosterone as just a number doesn't really tell the whole story, and it also doesn't tell the solution. Can your body actually come back to work? Can you stimulate your testes to produce more testosterone? And if that's possible, are you willing to just potentially stimulate your natural production back to where you want it to be to ideal levels? Or do you want to go around that to a point, if you have to, where going on testosterone becomes necessary? So those are things that, the answer is like, should you go on testosterone? It's a personal decision. It's your doctor and you's decision to make sure that, number one, you're kind of safe to use it, that you need it, and that you're prepared for the consequence of being on a long term.
Yeah. And so, there's things like, correct me if I'm wrong here, but like low libido is even something as well. Low energy.
Yeah.
Because I have heard a lot of people say, Derek, who was one of the guests on here, he just said, I just feel like a better version of what I should be. And even my other friend, who's also named Blake, he said the same thing. He's just like, I can't explain it. I just feel ready to go the whole time. Not in a sex way, but like even just a work way.
When I first got in this business, the idea of being low in testosterone was kind of reserved for old men, right? So for guys our grandpa's age or our father's age. And we used to think of this grumpy old man syndrome as being a definitive kind of term, right? Like you just kind of feel like, fuck life. Like you don't care. You don't want to get out of bed. You don't want to deal with stuff. And that idea of not wanting to like kind of conquer the day was like a determining factor that maybe you had low T. Well, then of course, like having sex drive issues, having erectile dysfunction issues, having body body issues in a sense that you're not used to. So if all of a sudden you start putting on fat faster, or your muscle tone isn't as good as it once was, those are signs that things are starting to tip the scale. But, not one thing points the finger. Like if you have low energy and you sleep like shit, or you don't eat well, or you have a really high stress job, you may have good testosterone levels, but obviously that energy issue is from something different. So, it's a combination of symptoms. Like we do this Adam test, the Adam test is really just a questionnaire that over a series of questions, if like the end numbers calculated accordingly, could point the signs towards a low testosterone level. And then we should do the blood work to validate that. And that combination really shows that you will or will not be eligible or in need of this stuff. Yeah.
Yeah. The Adam test was an interesting one. And a lot of people have been getting a lot of surprising results, which, I filled it out expecting myself to have low testosterone. And then
I found it interesting when I took it as the guy on testosterone, right? So
you pass?
Yeah, I did actually. It didn't tell me I needed it. But it is curious because some people, they'll go on testosterone and they'll still have those symptoms, right? They'll still say, I still don't have libido, or I still don't have the energy. Okay, well then it's like not the testosterone's fault that created that problem. Maybe you have a psychological issue when it comes to libido, or maybe there's some other hormones that are playing a factor in that. Yeah.
Even something like stress. Like I know personally at times if I'm really focused at work, I don't really have time to emotionally and mentally have sex. I know that sounds weird to dudes saying emotionally, but you know what I mean.
Yeah, for sure. Energy too, man. Energy is a big one. I could tell you so many times people think my energy levels are shitty. I got to have low testosterone level. Like energy is so wide spectrum. Everything plays a role in how well you eat, how good you diet, how well you sleep. All the things that we've talked about in previous podcasts that kind of play a role in this recipe of us. Yes, again, testosterone is a primary ingredient in fixing it, but not always a solution.
Yeah. And so what are some examples that you would tell people when it's maybe not the right time to take testosterone replacement therapy?
Younger guys, man. I mean, listen, you have a long life ahead of you. I get it when we're young in your 20s, like looking great, feeling jacked, like, when I was in college, and I'm definitely dating myself here, but when I was in college was during the era of Baywatch, and everybody wanted the chicks all were hot back in the day. You go to the pool party, so you wanted to have the abs, the six pack. Availability of steroids was quite prevalent in college, so when you're young at that point, it makes sense to do this stuff, but then you just got to remember, man, there's a long life that follows those few years. You can put yourself in debt at that time if you mess with it at the wrong time. So some times are like, number one, if you're too young, number two, if your heart is set on having children in your future, reconsider going on testosterone, because testosterone, like I said, it shuts down your balls' production of testosterone. and the balls are your factory of where sperm is produced. So it's not a guarantee that you become, sterile when you go on testosterone, but you're by all means lowering the probability. So if you and your partner or spouse or whoever are like adamant about wanting kids, definitely don't go on testosterone this early in life.
Because I know plenty of people who are on TRT that have kids.
Of course. And, listen, again, I've had guys say, I thought it was sterile.
Like,
no, man. You still can get somebody pregnant. It's just the percentage will lower the longer you are on it. And there's ways to preserve fertility with some use of other medications that you use in combination with testosterone. But that's definitely a big one for me. And then, of course, just like
what are some of those, if you can?
What do you mean?
Like, so the
there's other medications. Yeah, HCG. And clomiphene, gonadotropin. What these are, there's another one called HMB. These are different FSH. These are different type of hormones that are, kind of produced to mimic the natural stimulation that your brain sends to the balls. So, like I said before, when you take a shot of testosterone, there's this checks and balance system that we go through that your body's going to kind of analyze and say, hey, there's plenty of testosterone. Balls don't produce any testosterone. Well, that signal that kind of tells them to do it or not is luteinizing hormone. So you can mimic luteinizing hormone or synthesize it and use it through those other drugs, which is basically artificially sending that signal to your testes to say, keep making it. So I could take a shot of testosterone, which would inherently tell my balls, don't make testosterone. Then I could take a shot of HCG, which would say, balls make testosterone. And you kind of go through this on-off switch kind of scenario.
Yep.
The question is how long can the on switch, stay on versus the off switch being pushed off with the testosterone shots? And there is no answer to that. Some people are lucky and can be fertile for a very long time, and some people not so much. I remember there's been trials to try to wonder if testosterone was a male contraceptive. And of course, that was never validated, but they wanted to use it as like a male contraceptive to kind of shut your testes down. Because again, it only takes one sperm to find its way.
Yeah.
Now you're either lucky or the unlucky guy. So.
If you're interested in finding out whether or not you may or may not have low testosterone, there is a free online test called the ADAM test. Now, this questionnaire takes only 60 seconds to complete and has up to an 88% accuracy rating. To access this free test, you just go to bit.ly/free ADAM test. That's bit.ly/free ADAM test. And if you don't want to remember that, the link is in the description of this video or audio if you're listening to it. bit.ly/free ADAM test. Find out, 60 seconds. Got nothing to lose. Let's get back to the show. What are the benefits of taking TRT for people?
Listen, if you're getting to the point where you're considering doing this, generally the factor that brought you in, whether it be low sex drive, low libido, low muscle tone, increased lean, increased fat, those particular high level kind of symptoms, if you will, are generally reverted to some degree. If they're an influence of the low testosterone. Again, symptom plus blood work, combination of the two validates, the need for it. So if you're all of a sudden putting on body fat and you're dieting and you're exercising, you can't put on muscle mass, and you feel like you should be because you're doing everything right and your testosterone levels are in the dumper, well then it's like, okay, obviously you raise your testosterone, you're going to fix that problem to some point. So primary benefits: increased energy, increased libido, increased muscle mass, decreased body fat, increased cognitive function, like how clearly we think, how much drive we have. That's also, to me, a big factor. I feel like, and if women, you're listening to this, this is not a dig at the one side or the other, but I feel like we have this drive when our testosterone levels are high. Some guys can push that too high and it turns into aggression. We call this roid raging. But I know me, like when my levels are high, man, give me a problem and I will tackle it head on. Just like if you're going to be confronted in a fight, if your testosterone levels are low, you're probably going to like wimp out, and turn your back and run. If testosterones are high, you're like, let's go. So the same comes with the problem, in my business life. I don't think I could do as much shit as I do if my levels weren't where they were. Like Derek said, and here we have this entrepreneur who's traveling all over the country and having to make really, really spot on big decisions. he can do that because his levels are high, right? So
Yeah.
so he's firing on all cylinders.
Yeah.
And part of us being men, that drive, that thing that we are, that fire in our ass, that comes, I think, from the hormones that we have.
Makes sense. Yeah, if you think about just the psychology of it, when you see, like you mentioned, the old grumpy man syndrome, that's when their drive starts going away.
Yeah.
And
I mean,
it's
some of the
because
most
it's
driven
depleting.
business guys you see as they get older, not because they're becoming more complacent, not because they've become successful, but I just think they lose a part of that drive that keeps them wanting to like further their careers. And now that's being a little bit different. We're seeing older guys and crushing it because their hormone levels are old. Look at Jeff Bezos, right? I mean, we know damn well he's on testosterone and Elon Musk, these guys
He's
that used to look
definitely
like, hell yeah. I mean, they used to look like, dweeby computer guys, and now they're all jacked and look great.
Well, it's interesting because now that I'm thinking about it, what's the Napoleon Hill book? It's Think and Grow Rich. He says that after he studied every single high performer, that all those high performers had one common thing. And that common thing was that they had a extremely high sex drive, but would channel it into their work.
I can see
and
that.
so that would
I mean,
probably...
people say sex drives you to be successful or drives your desire to have money to one degree. Like, why do you want to have a lot of money? You want to have a nice car. You want to have nice jewelry.
Status,
You want to
baby.
influence people, like, right? You want to impress. And I think part of that comes with getting some ass, I think, right? So whether you're...
So I'd wonder if those guys had a high testosterone as well, like high testosterone level, which gave them that drive to become such high achievers.
You would think. I mean, I don't know. I know Tony Robbins has admitted to having a prolactinomia. And prolactinomia is
What's
like
that?
a little pituitary abnormality that secretes more hormones into your system. And he's had this extremely high human growth hormone levels because of it. But he also has an extremely high testosterone level because it's secreting the hormone that stimulates his testes. And he's one of the most successful guys of our time.
And he just had a kid at 60 or something.
Yeah. So
The dude's still shooting real bullets.
Still out there killing it, yeah.
Okay, so with taking TRT, what is the risk of ED for people taking it?
Yeah, you hear about these guys, a complaint. Sometimes people say, well, my sex life was never a problem coming into this. I didn't have ED. Maybe I didn't want to have it as often, or I was more tired, therefore I didn't do it as frequent. And now I'm on testosterone and I'm finding that I actually need like Cialis or something. It can come from like a plethora of problems, one of which is a side effect of testosterone use is what's called polycythemia. And polycythemia is the overdevelopment of red blood cells where your blood gets pretty thick, almost like sludgy. And that's because like androgens in the testosterone stimulate red blood cells development, so your red blood cell count gets high. And a remedy to that naturally is just to go give blood, right? So if you go down to Red Cross and you donate some blood, you kind of thin out your blood. But with that being said, if you don't do that, that thicker blood has a harder time kind of getting into your penis to create it and make it erect. So having too thick
Doesn't
of
make
blood,
it bigger?
No, you would actually, when you think
Makes
about
it
the way
thicker.
that thick blood kind of can't get in there and volumize, those thinner vascular systems that create,
Gotcha.
your erection. So that's number one. The second is the byproduct of testosterone is estrogen to some point, is sex, SHBG was sex hormone binding globin or sex binding globin hormone. Yeah.
That sounds
Either
too
way.
smart for
Either
me, I'll be
way.
honest.
So these byproduct hormones that your body kind of produces to some degree, kind of protect itself. And I think having too high of estrogen, or if you're combating it with an anti-estrogen, which is a natural product that most people take when you take testosterone, having an off kind of relationship between estrogen and testosterone can create this. So I think it's just messing up your endocrine system to an unnatural level, meaning like your testosterone levels are way too high, or maybe your estrogen levels are way too low. That can create some of that unnatural, sexual behavior pattern. And some guys get super high libidos and feel like they want to screw everything in sight. And we've had guys who've,
I got a couple of friends like that.
Got divorced because they've been on testosterone now.
Don't do that, guys.
No, don't.
Be a good man.
But some people, they get ED issues. So then, of course, they have to like resort to doing like Cialis or something like that.
Yeah, okay. Now, one question that I've had, I've seen in the comments of our other testosterone episode, cycling. Everyone always thinks about testosterone equals cycling for ongoing men's health, is it a cycle that you take it on, or is it more just day to day, and how do you do it?
Yeah, so cycling, guys, is like when you're going on it for a short period of time, coming off. And the purpose of coming off is to not shut yourself down permanently. So you, for instance, like you're not on testosterone. So let's say you had some desire to like go on testosterone to put on some muscle mass, and you have a naturally decent level to begin with. You would go on testosterone for, 8 weeks, 12 weeks, and then you would come off. And then you would do like a post-cycle therapy, which is the use of HCG or enclomin or gonadorel and those drugs I mentioned earlier, to stimulate your testes to come back to life. And then you would have life after, which would be hopefully bringing you back to normal. And then you would do it again. So that's not like what we at these clinics do. When you're going on testosterone replacement therapy, you're literally replacing your body's natural production. So once you go on, you're on. So no medical doctor who prescribes testosterone in a TRT setting should rightfully so put somebody in a cycle kind of concept, because if your levels suck to begin with, enough for them to be shitty enough for us to validate prescribing it to you, we're just hoping to get it back to that shitty level they were to begin with. What's the point, right? So just go on it consistently. And I know that comes with like the immediate question of how safe is it to be on all the time? Remember, we're sitting here producing testosterone every single day of our lives as men. Naturally, that level is supposed to decline. And when you're using testosterone replacement, you're going into these like really excellent, superficially high levels for a consistently long time. But if you're getting your blood work monitored and you're looking out for the potential problems that it can create, it can be a very safe thing, to a point where it can be more safe than not doing it, because it can prevent other problems like obesity, diabetes, and cardiovascular disease, which can be found with like having really low testosterone levels. So, you just have to make sure you're doing it smart.
Yeah. And so the purpose of taking TRT consistently, is that to regulate the hormones so that you're at a normal rate rather than spiking and crashing?
Yeah, exactly. I mean, when you do shots of testosterone, the common, most prescribed medical version of testosterone is called testosterone cypionate. That word cypionate refers to the ester that's bound to it. Now, ester refers to a molecule they attach to it for the duration of time, which is called the half-life of the drug. There's a variety of them on the market, from propionate, enanthate, cypionate, undecanate, and all those words are going to be associated with how long it lasts in your system. So testosterone cypionate from a medical standpoint is ideal from being a once-a-week shot, because its half-life in kind of roundabout ways is 7 days. So if I take a shot today, I'll have essentially a peak tomorrow and kind of a gradual decline. And then in a week, I'll take another shot and kind of repeat the cycle. And so the variable between the high and the low isn't too extreme. It is definitely higher on the day after and lowest on the trough point. But keeping it as consistent as possible is the ideal.
Yeah.
There are people in more kind of experimental ways using testosterone cypionate more frequently, like biweekly injections or even every other day. I've even heard of people taking microdosing. And this is to keep your levels as consistently, ideal without the high and the low. I personally take 2 shots a week. I don't mind the injection. If you're needle phobic and you don't want to do the shot as frequent, do it once a week. I mean, I know clinics out there. There's a big one around here that gives people a shot every 2 weeks with a high dose, which is just a horrible idea, because essentially what you're doing is you're loading your system. It's like having one giant meal for breakfast and then not thinking that like that's going to be a shitty diet, because essentially you're overloading your system at a point where it's going to have this extreme high and extreme low. And what happens in our bodies is that there's another balancing system that we produce estrogen. When your testosterone level goes real high, your estrogen level goes real high, but it tails it, right? So testosterone's super high on Monday. Estrogen, to some degree, is very high on Tuesday. As the testosterone level begins to decline, the estrogen level declines slower. So at the lowest point, you have this really higher estrogen to testosterone ratio, and that can create water retention problems and actually the formation of breast tissue called gynecomastia. So taking shots not frequent enough is even worse than taking none at all. So if you're doing these like clinics that, again, they give these people these every 2 week shots. It's just, you're not doing yourself any justice, and to a point you're actually probably putting yourself in a worse off position.
Yeah. Okay. So frequency is a much better thing for this.
Yeah. Keep it in your system more frequent. I'd rather have a small dose as frequent as I can within reason of taking
sort of like
an
wading
injection.
water in a way, like treading water. Sorry.
Yeah, you want to have not
Versus trying to
super
dive.
highs, not lows. You know, you want to
Yeah.
have as consistent of me as I can get.
Yeah. Okay. I mean, some people are super needle phobic.
Yeah.
Is there a way in which you can take TRT without an
Yeah,
injection?
there are. I mean, like there's gel topical products where you literally put this like gel on your body. There's I've heard of guys putting these like topicals on their scrotums.
What?
Yeah,
Just as
don't
a
ask
lube
me.
or
I've never
something?
I've never tried.
Like, just
Supposedly
jerk off and-
no. Supposedly the gel and has an absorbability benefit on the scrotum.
Sounds like someone with a fetish.
I've
bro.
read like studies that I've read studies that the topical products can create a higher DHT conversion. So again, like testosterone converts to other stuff, right? So testosterone, when it converts to DHT, which is dihydrotestosterone, that's where some of the bad stuff from testosterone comes from: the hair loss, the prostate enlargement, cardiovascular disease events. So topical products tend to have a little bit more consequence to the use. It's also like, let's be honest, man, what guy wants to put a gel on every single day that then you got to worry about transferring it to your wife potentially? So if I put it on my arm and my wife lays on me, I'm going to transfer it to her. I'm
And
putting
if you
a
have sex with her and you rub it down there, she might grow a penis.
Exactly. Some. You know, so to compare, like women use topical gels that are 1 milligram per milliliter. Men use gels that are 200 milligrams per milliliter, right? So 200 times the percent greater, but their receptor sites are so absorbent of testosterone that they get a really good response from a low amount. So if you're a man and you put it on you, and now she touches that small amount, she'll have extremely high levels to a point probably higher than you.
Really?
And that's a problem with the topicals. I don't like them. We don't prescribe them. We don't mess with them. I have noted in the past when we have let it happen, generally we see really high PSA spikes from it.
What's PSA?
That's a prostate-specific antigen. So that's when men's prostates start to essentially swell and grow, and that's what can lead to like prostate cancer and problems down the road, or excessive higher hair loss issues. Then there's pellets, which is where they insert this kind of looks like a cocktail straw that has these little tiny dissolvable pellets into your butt cheek. And over a few month period of time, those pellets are supposed to dissolve.
What?
Yeah, it's kind of more geared for people who want like higher levels, but like don't want to go through the hassle of the injection. But then it's like,
That's
well,
weird.
fuck, now I got to get this surgical insertion, a stupid straw that's going to potentially pop out and create other problems. But I've also heard with those, you get way higher estradiol conversion because the testosterone's in your system for a longer period of time, and that estrogen conversion becomes a problem. So then you have to combat that with an aromatase inhibitor. But the issue with this is, as the molecule or as the pellet dissolves over that period of 4 months, let's say, and you're using the same amount of aromatase inhibitor from day 1 through day 120. At what point are you using too much anti-estrogen to combat too little of testosterone because your body has dissolved a lot of that pellet? So, guys, if you're doing pellets out there and you're getting a good experience, like no harm, no foul, like good for you. If you're using gel and you like it, that's great for you. But we at our practices, we're just big advocates of injectable testosterone only. You get what you get. You put 150 milligrams in that syringe and you inject that 150 milligrams. You got 150 milligrams.
Yeah.
In the topicals, your pH balance of your skin, how much sun you get, how much sweat you had, the quality of the base of that stuff that it was produced in, all those would be a variable. How much you actually absorb. It's just too difficult to keep the numbers. In
It's
something
too
that's
many
easy to figure
variables
out.
for
It
something
is.
that's
Yeah, it is.
really important for you.
And I've had guys come from other clinics that, their family practitioner put them on Testogel or Androgel, which are these commonly prescribed stuff. And their testosterone experience has been pretty shitty. They're like, I don't really feel much benefit, or whatever following side effects happened. I got really bad acne, or, my hair started falling out, or I couldn't pee from it, or whatever. And is injectable going to be a better result, And of course, like, I'm just like, listen, it's a very different experience. I can't promise you better, but promise you different. And of course, they try testosterone, and for the most part, every one of them said, holy shit, like, this is so much better. I feel better. I look better. My results are what I wanted. So
Yeah. So I've got a couple of questions that a bunch of people asked me to ask you because they were curious. So The first one is, can TRT cause high blood pressure?
Yeah. So coming back to this polycythemia that we stated before, the red blood cell development, just having that thicker blood going through your veins and artery system is going to create more of a need for the heart to kind of increase the pressure to circulate it. So that's number one. If you're having blood pressure spikes, you definitely got to go get rid of some of that excess blood. If you have a higher aromatization where your body's producing estrogen more so because of the testosterone, you'll tend to get more bloated and more water retention. A common remedy to high blood pressure is a diuretic. So if you've ever talked to anybody who has high blood pressure, they're advised to like reduce sodium intake, definitely like try even like a low carb diet, drink more water, and or take a diuretic. And that's because of that water retention problem. So if we can limit the water retention, which is from the aromatization, issue, then you can control the blood pressure spike. Sometimes people say like, oh, since starting taking testosterone, I feel bloated, and generally it's either because they're taking too high a dose, or again, they're not monitoring their estradiol production. So we can fix a lot of that with more frequent injections to keep the ups and downs, not so erratic. And also the potential integration of low-dose anti-estrogens.
Yeah, okay. The second question was, and you touched on this earlier, but can taking TRT cause hair loss?
Yeah, for sure. Most of the time, hair loss is kind of pre-programmed in you to begin with. It's not the testosterone's fault. It's the testosterone is essentially a little bit of a gasoline on that problem that was going to happen regardless. One of the things that we find is a common reason men come to us with sexual side effect issues or lack of muscle tone or increased body fat is that earlier in life, they had hair loss issues and they were put onto a drug called Propecia or finasteride.
Oh yeah, I've heard of that.
So it's a common like stop losing your hair because what it does is it blocks DHT. I mentioned earlier, DHT is kind of a spin-off of testosterone. So testosterone kind of converts to DHT. DHT is the workhorse of testosterone. It's a really strong portion. It's the thing that really fuels sex drive. It's the thing that really fuels muscle growth. It's the thing that really fuels fat loss, but it also fuels the prostate enlargement and the hair loss issues that come with testosterone. So when you block it and you don't have enough testosterone, you're blocking all of it, right? So now all of a sudden, sure, the hair loss doctor did a good job. He don't give a shit about your sex drive or your muscle tone or your body fat. Because when you come in with a full head of hair like you got, he's like, see, I did your job. Meanwhile, you're like, buddy.
That's why everyone thinks I'm low in testosterone.
But I can't fuck, and and I look like shit. And it's like, he doesn't care. So what happens is too high of testosterone, if it's converting to DHT and you are susceptible to hair loss to begin with, you're going to accelerate that. So, we do use variations of either low dose versions of this Propecia products, which is, the finasteride, or topical products to help suppress that. And it also comes with not overdoing it, so of course, keeping your testosterone levels within a manageable range. And if you're super concerned about it, there's ranges within the range of testosterone. You don't have to be on the highest point just because the doctor said you're capable of going up to that point. Like I got guys, for example, that will authorize them to take 200 milligrams a week, but they may opt to take 120. They don't need to take all of it if they don't want to, because maybe 120 gives them enough of a boost to feel good, but it also like prevents the problems that going up to the 180 or 200 could create, either development of red blood cells or accelerated hair loss. So it, like anything else in life, I feel like testosterone comes very much with a risk versus reward. There are risks, like you got to be careful. Nothing in life that has all great aspects to it has no risk to it. And if someone's, blowing smoke up your ass like that, then, be careful with who's selling you the idea. It comes with potential risks that you should try to avoid, and part of that's our jobs.
If you're noticing a drop in energy levels and libido, listen up. After the age of 30, men's production of testosterone starts to decline year after year. And with this comes challenges like trouble losing weight, feeling tired, lowered sexual desire, and a lower drive to be the best version of yourself. A comprehensive blood test has become the industry standard for showing fast, accurate, total testosterone and free testosterone levels. And this information is vital for understanding if it is necessary or unnecessary to take the next step. with TRT. To get this blood test, go to bit.ly/tclinicsusa. That's bit.ly/tclinicsusa. Or if you can't remember that, the link is in the description. Now let's get back to the show.
The other one, which is commonly asked, is what is the difference, if there is a difference, between TRT and steroids?
I mean, testosterone is a steroid. It's the fundamental kind of core to any bodybuilder steroid cycle. There's usually androgenic and anabolic steroids. An anabolic steroid is more referred to something that increases protein synthesis. So the speed in which your body converts the protein you consumed into muscle tissue. That's not what testosterone has, an anabolic and an androgenic property. The androgenic side is how much it increases the androgens in your system, which is those benefits we talked about with sex drive and muscle mass. So yes, it is if abused. Well, I mean, the straight answer to your question, yes, it's a steroid. It's a steroid hormone, but
usually people,
in the context in which we're using them, it's not really going to tip you into this like bodybuilder side. But I can guarantee you, every guy that you've seen that's a non-natural bodybuilder, has used testosterone in combination with some anabolic steroid or other hormones.
Yeah. And so if you're taking TRT and say you're not working out, what would be your, is there a reason to take TRT if you're not going to work out?
Would you cut your balls off if you don't work out?
I like my balls, so probably not.
I mean, that's such a stupid question that unfortunately I get so often. It's like, would you not want to be a man if you don't go to the gym? Like we are men because our bodies produce testosterone. Would you not want to have that drive to go, have that extra effort? Would you not want to have that ability to be more athletic or pick up your kids when you go in the pool with them? All those things are contributory of like some degree of your hormone balancement, right? Or have sex and have kind of that extra energy through your daily lifetime. So please, guys, don't just think I don't go to the gym, therefore I shouldn't do testosterone. You know how many guys I'll have their clients of mine that I won't talk to them for a few months, right? And we'll be like, are you like, what happened? You stopped taking it? Oh, I stopped taking it because I hurt my knee, so I've not been in the gym for the past 4 months. And I'm like, so you just stopped taking testosterone? And they're like, yeah, I didn't think I needed it because I wasn't in the gym. I'm like, no, man, like, first off, you probably healed slower because your muscle in that leg is now slowing down the speed in which like you're healing during that process.
Should have gotten some BBC.
Well, that too, and take some growth hormone products. But call us up if you want some additional
BBC all the way, boys.
But testosterone just does every other thing that during that 4 months that you weren't at the gym that you just neglected.
Yeah.
And now because you've turned your body's testosterone production off, you have a higher probability of higher estrogen and other problems that can create their own problems or increase body fat production, increase insulin sensitivity, so it can get you obese. I mean, there's just like, kind of the problems go on and on and on.
Yeah. Actually, that leads me to the next question. Like TRT with weight loss, a lot of people ask, does that help with weight loss? And if so, how?
Yeah, so weight loss, let's just look at it from the true definition. Weight loss is pounds off of in the scale. Sometimes when you go on testosterone, the scale goes up, right? Because why? Because you're increasing muscle mass.
Yeah.
Is that bad weight gain? No. Is it not weight loss? Technically, people get a little, kind of upset that they're not seeing the number coming down. I think it's contributing to a healthy weight loss program, because if I'm saving my muscle while in a calorie restricted diet, then I have a higher muscle mass to body fat ratio. That's why I can sit here with my amount of muscle mass and probably eat more shitty food and not get fat than an older female who has, very low testosterone levels in relationship and lower muscle mass in relationship, because the consumption of the calories from my muscle or my metabolism, is slowed down and hindered because of that. So you don't want to probably take a lot of testosterone if your sole goal is to drop weight and get smaller, because to some degree you're increasing the muscle mass and that will get a little difficult. Muscle will also make you a little bit more hungry, so then being in a really tight calorie restricted diet gets rough. That's why if you take semaglutide with it, it tends to be really good.
So you paired the two?
Yeah, of course. I mean, again, because most of the time for more of our clients, testosterone's a staple.
Yeah.
And it's consistently in their lives. So then when we add on the BPC, or we add on the peptides, or you add on the semaglutide, that's just being complementary. But even on our website, if you read under the weight loss section, testosterone is one of the first identifiable things, because if you're trying to lose weight and you're really having a hard time with it, and you're exercising, you're dieting, and you're like, what the fuck, I can't lose weight, look at your testosterone levels, because if they're not ideal or your estradiol levels are too high, it's going to be a really rough road for you moving forward. So getting testosterone to where it should be in comparison, you're going to see the results a whole lot faster.
Yeah. And so with TRT, there's a bunch of different versions out there you can get. A commonly asked question is, what is the safest one? If there is one.
Again, from our perspective, first off, the safest one is one you get through a doctor. Black market stuff on the streets, no. Who knows what's in those bottles anymore? Again, we're big proponents of the injectable versus topical versus pellets. Testosterone cypionate or enanthate tend to be the most common prescribed. Enanthate is just a fraction shorter than the cypionate molecule. So usually like 5 days versus cypionate's like 7. I've read somewhere on enanthate it can be 5 to 7 and cypionate 7 to 10. But regardless of that time frame, it tends to be a little bit shorter. The really short-acting ones like propionate, they have a little bit higher conversion rate to DHT, which DHT to me is the most dangerous part of testosterone. So because it creates the two major problems that we try to avoid, which is prostate issues and cardiovascular disease problems. So if you can maybe steer away from propionate, plus the frequency of those shots becomes a burden. You're doing a shot every other day, and they don't feel good. So those shots I would say avoid. So again, like safety is what comes from a doctor and is prescribed by a real pharmacy, and usually again like cypionate or enanthate.
Yeah. The last question I've got is, when do you typically see, like, what's the most common time that men start probably needing to have or look into TRT?
Like age-wise? I mean, statistically, those numbers are getting lower and lower. We used to see it was like men in their early 50s starting to kind of turn that curve. It's becoming younger. I don't know if it has something to do with lifestyle choices that we made, like me, that I screwed up in college and I dabbled in hormones. Anything from drugs like opiate prior use can create like a deficiency in testosterone. If you have a really bad lifestyle, whether it be partying and drinking too much, not sleeping enough, you'll have a deficiency. So I think the answer to that question nowadays, there really isn't anymore. It's when you feel you're not at your best anymore. And we'll touch on this in another show, but there is a way to avoid replacement and just to boost your natural production.
Yeah.
So just because you may fit into those two categories of like younger and may want to still have kids, don't consider testosterone the word out of your vocabulary. It's just replacement should be for the moment. Maybe boosting, your natural levels would be ideal. But I'm
just trying Tonguite Ali at the moment.
Yeah,
I think tastes like cyanide.
I've seen some recent kind of studies that show it's not all it's cracked up to be, for long-term use, and has a short-term benefit versus some of the longer ones.
Jeff and I are doing a split test.
You mentioned something earlier, like about you're not ready. I think one thing you have to consider is we have one time in this life. We have one time as men in this life, and oftentimes we get guys that wait till they feel like shit before willing to fix themselves and start feeling better again.
Well, that was one thing I learned from Derek. Why
wait? It's like the analogy I always give guys is like when I remember when I was younger and I would lease a car for 3 years, right? The day I would drive it off the lot, I would take it straight to the place to get a custom set of wheels put on. And people are like, "What? You just got the car? Why are you putting new wheels on?" I'm like, "Because, bro, I'm only going to drive the car for 3 years.
Yeah.
I want cool wheels on it for 3 years. Why do you want to go through your late 20s, your early 30s, your late 30s? If you're ready and inevitably you're going to get on it, don't wait until you hit a bottom point before you're willing to get yourself back up and waste those years in between. These are our best years of our lives, right? I think any time in your life should be considered your best time of your life.
Yeah.
If you can live it to its fullest.
Well, the reason I'm waiting is obviously we want, excuse me, we want like 1 or 2 more kids.
Well, then, yeah, that's
We did
the
our
good reason.
testosterone levels, and Jeff was super happy. Just got to work on my free test a little bit.
Yeah, and I mean, by all means, listen, if your testosterone levels are good, don't do it.
That's the thing.
If you're like a B grade student in the testosterone level range, and you can cheat to become an A plus, but you decide to fail, cheat or whatever, get caught, and you can go down into like a DF category, it's not worth it. But if your levels are in that C minus category, and you could cheat to become an A plus student, I think it's worth doing. And so
Well,
if
that's
your
the
levels,
important thing too of getting tested.
yeah.
Getting the blood test. Like I got mine with you guys, mainly because my wife was convinced I had low testosterone. We've mentioned this before. And that it was actually pretty cool to see, like, oh no, it's just that I'm focused on work. And Jeff was able to break that down to me and be like, you don't need to take it yet.
Yeah.
And that was
One
really
thing I'll
cool to find
stress
out.
about blood work. Blood work is a snapshot of your life at that very moment. If you do blood work 5 times over 5 months at different times of the day, different sleep the night before, had you had sex early before, had you been stressed out, did you eat right, did you not, your number's gonna be all over the board.
Okay.
Make sure when you do your blood work, it's at a time in your life where you're feeling the way you average feel, and I see this where people do a blood work and their testosterone levels are just terrible. But then I'm like, what's going on in your life? Oh man, I just got back from Vegas. I was on a 3-day bender and, work's been super hard and I've been eating like shit. And I'm like, okay, we're about to make a lifelong decision here on a snapshot of your life that's not normal.
Yeah.
You just didn't sleep, did God knows what while you're out there, and you're telling me that this is not the norm. Why don't you reset back to the norm and then recheck you then and see realistically where you are before you make this decision? Because you could fix yourself through a boosting. You could avoid the inevitability of having to do this. Don't just because you decided to do a blood work and the numbers show that you have a low testosterone think, oh, here it is, I need this. Like that's not always the answer. Recheck multiple times. Make sure again, lifestyle seems to be consistent.
Yep.
And at that point, if things are consistently showing low, then it's time,
Yeah.
time for you to make that decision at least.
Perfect. Cool, man. Was there anything else we need to cover? I don't know.
I think we did.
You've blown my brain, so it's good. So guys, thanks for checking in. Now, if you want to quickly find out if you might have low testosterone, the Adam test link is in the description of this podcast. And then once you get that, you'll find out some more information about whether or not you may or may not. And if you don't want to do that, and you just want to jump straight to contacting T Clinics, that link is also in the description. It is bit.ly/T Clinics USA. And thanks, man.
Thanks, man.
All right. Peace. Subscribe.